I was in a mental institution. You know, I had all these problems. So she gave me Dr. Miles' number. When I started seeing him, he said everything was going to be fine, but all of this started coming out. I got worse instead of getting better. Well, over time, he's like, you know, he was very patient with me. And actually, a personality came out in his office. He was calm. He was very calm. I almost attacked him. Okay, so he let me lay in the back. I calmed down. He checked me again. He was very patient. We talked about this.
Yes, we did.
I didn't know how to even face him. I didn't know what was going on. So I left. And when I came back the next time and I told him what you said, everything, he said, that's fine, no problem, you know. But my personality started coming out more. I didn't know. 2 of them. Okay, because of the medication that I was taking. Okay, so it numbed them. Okay, so over time, when I started seeing Dr. Peddy, and he really started helping me, that's when I started finding out. One personality is a black girl, 16 years old, big girl. She was saying goodbye to me. I know that this is hard for somebody to understand, but it's true.
Yeah.
The other personality that I had is a boy. He's 5. Isn't that weird? And the other personality is from the 1800s. It's a lady. She was a prostitute. Yeah. So all of these personalities started coming out, but they were saying goodbye to me. Whenever I went into the personalities, my family really didn't know. They just thought I was mean. That's all. That's it. And they thought, she's crazy. She's crazy. She's just crazy. You know? But now that I understand what was happening to me, I wasn't crazy. You know, I was just not alone.
Yeah, now they can see that too, just seeing your 180.
Well, they're here.
Yeah.
You know, they're here today.
The whole family.
My whole family. My dad came from Texas. My sister's laying in there, and the 2 of them up over here. So, and I have other cousins, and my daughter, and my husband's coming in because he's really sick now.
And
So
he certainly saw the changes.
he saw a lot of changes, and he like they can't believe it. My digestion started. I mean, this wasn't working anymore. Stomach problems, all of that. I had it all. I was sick. So.
Awesome story.
Yeah, I'm better now. Doing good. Right?
I get it. She says I'm the sister.
I weighed probably like 270? I weigh 189 right now.
Wow.
Are you still losing?
Yeah, I haven't gained anything. I'm just in a stall right now.
Wow.
Yeah. But I lost a lot of weight.
So how long have you been under upper cervical care?
10 months.
10 months under.
10 months. 10 months with 3 months with Dr. Miles and the rest with Dr. Peddy.
Yeah. And didn't you get a van or something so you could put your family in it? So that
We
they
traveled with it was my truck.
Truck. Yeah.
It was my
There
truck.
was something I couldn't remember.
And there was 5 people coming with me the first time.
Yeah.
The first 3 months. And then there was then we traded, and there was another, I got more people coming. So there's 15 people in all, I think, here, plus my sister.
Yeah. Are most of them family?
Well, I know everybody. I know all of them.
I would suspect that you do.
Oh.
Yes. It is so. I knew it was you the minute I said, and I had never seen you before.
Yes.
But I knew it was you. Just your.
I guess
You
I
came
think-
across.
Nice to meet you too.
You came across the telephone just like you came across.
This is my sister Eva. This is Mr. Tomasi.
Hi, Eve. I'm James. How are you?
Good, how are you?
Good.
And this
very
is
well.
Rhonda, his wife.
That's my wife, Rhonda.
Nice to meet you.
She's the camera taker.
Oh, don't do that.
Please don't do that.
But do you remember I talked to you about him? About James Tomasi.
the one that writes?
The book.
Book what time Tuesday?
Yeah, you have to listen to that. It's really good. I think that helped me throughout everything that I was going through.
Wonderful. Those, you sound better. I never saw you before, but you look better. If
I
that
look a
makes
lot
any
better.
sense. You know.
Do I look better? You gotta be honest.
Yeah.
I look better.
But if your whole family have been with you all your life, and if your whole family is gathering around you tighter and tighter, they must see the positiveness to it. Plus, it helps them, and they know, and then who else, and who else, and who else. But that's the way this kind of work gets around. There's no television, there's no big advertising things. It's just word of mouth. Just, hey, and you go, oh, I really like that, or whatever. But you just keep telling somebody about it.
Mr. Tomasi had a root canal done,
Yes,
and they did something to his nerve. Something happened.
yes.
Well, your nerve. Or they pulled the tooth, or what did they do?
Well, they did a root canal.
Uh-huh.
And that root canal, because I was in a dentist chair for about 6 hours, what happened was, I had trauma as a child, a couple of automobile accidents, but my head laying in that position disturbed that atlas in such a way that it made that injury actually turn into TN. And it became full-blown TN, which is the suicide disease. So the stronger it comes, the more. And I'm a Christian, and yet I've got these things in my head that I'm going to kill myself. And same thing, Rhonda just happened to hear somebody not unlike you talking about Upper Cervical over a radio station, and she listened to it, and I'm dying. I'm within hours of killing myself. And talked me into going. I said no, and I was such a skeptic, and it's a chiropractor, and please don't tell me about Upper Cervical. I don't even know what that is. And she just kept saying, no, James, I really believe that this is for you. And of course, within 11 days, I was completely out of it. And that's 13 years ago. And now we just travel all over the world talking about encouraging you, your sis. And maybe it isn't for just you, although it was for you. Maybe it isn't just for your sister, but maybe there's someone that will come along in your life that has been praying or looking for an answer, but they've been told, forget it, it's over for you. You can say, well, maybe there's something else you could try. Let's go find an upper cervical doctor. When we first started, there was 70, 80 of them. Now there's 2,000 of them.
Wow.
We've got 2 sons, that son, and then this son here that just left. He is in Sherman, an intern, so he's got another year and a half to go. And then he'll be out doing the same
Amy?
thing.
Yes.
Maria.
Okay. Excuse me.